Hi, everyone. I'm Brian Rosenberg, and I'm the founder of Days with Kids. Thanks so much for being here. You know, one of the most important things we do here at GWK is actually help you become dads. And how do we do this? We do this thanks in part to the wonderful partnerships we enjoy with some of the world's leading organizations across surrogacy and IVF, adoption, and foster care. And tonight, I'm going to have the great pleasure to introduce you to our newest family building partner, Dr. Allison Bloom of Main Line Fertility in Philadelphia. So in just a second, I expect Dr. Bloom will request to join us and we'll get to meet her. In the meantime, for those of you who don't know, Main Line Fertility does have over 6 locations in the greater Philadelphia area, and they have been leading reproductive medicine for over 25 years. Looks like I have a request to join.
Yeah. Hello, yay.
We did it, all right.
How are you?
Hi, Dr. Bloom, how are you?
I'm doing great. Yourself?
I'm well, too. Thanks so much for joining us.
Absolutely, my pleasure. Thanks for having me.
Oh, it's our pleasure. And it's great to officially welcome you, take this opportunity to officially welcome you and Main Line Fertility into the GWK Family Building Partner Program, where you're going to help support a lot of people on their journeys to surrogacy. So thank you so much.
Absolutely, my pleasure. I'm excited about it.
So, Dr. Bloom, I'd like to give people an opportunity to get to know you. So, okay. Do you want to share a little bit about your professional history?
Absolutely, yeah. So, kind of a long journey. So after med school, I actually did a residency in OBGYN. And I worked as an OBGYN delivering babies and just doing general gynecology for 5 years at Pennsylvania Hospital. And then really sort of decided that I wanted to pursue the fertility world. And a lot of that passion had to do with supporting the LGBTQ population and building my family. So it just sort of fell into place. At that time, my wife and I were talking about having kids. Of course, we had to go seek help because, I mean, yes, you can get sperm and do it at home a little bit easier than a single male or 2 men having children. But most people will still go and seek help, and you kind of go on this journey and you want someone that understands you. You want someone who can really take you on this journey, because there's a lot of things that are not obvious. And I think it's important that people are comfortable in that and really have the forum to ask questions and be connected to their providers. And I just felt like this is something that I felt passionate about, and I was excited going through it myself to say, all right, you know what, love delivering babies, love what I do, but it's time to go back to school in a sense. And, you know, then I embarked on a 3-year reproductive endocrinology and infertility fellowship, and then joined Main Line Fertility. It's been 2 years this July officially, although I had been with them for 3 years of fellowship, and back as a resident, I rotated with them. So I have a long history with Main Line Fertility. Obviously, I kept going back, so I feel good about the practice. You know, some of the same nurses and same people are there for the last 14, 15 years since the first time I stepped in that door, which I think says a lot that it's really a family. As opposed to just any other clinic. People are really treated differently and support each other and our patients, I think, on a different level, which I'd love to be a part of. So that's a little bit of my education and medical history and how I got to this place. We underwent quite a journey. You think, oh, just going to go through this and have some donor sperm and, you know, get pregnant. And as a physician, you know, I have a fear of pregnancy. So my wife embarked. I was hopefully the supportive partner. You know, after 6 IUIs of being unsuccessful, we then, you know, ended up doing IVF. We did an egg retrieval, had an embryo transfer that failed, and then transferred 2 embryos. And we have beautiful twin boys who will be 5 next week. So going through that as a patient, I think really helps me understand on multiple levels, not only being a part of the LGBT community, but also being a patient going through not the easiest fertility journey. I think has sort of molded how I am even more as a physician and a doc, you know, as an infertility doc than anything.
That's great. I was actually going to ask you that exact question. But I couldn't agree more. And so tell us what drove Main Line Fertility's decision to become a part of the GWK Academy, and one of our partners to fatherhood.
Yeah, absolutely. So as long as I've known Main Line Fertility has been supportive of the community. And when I stepped foot in that door, they knew this was my passion. And since I stepped foot in that door, I've had nothing but support moving forward. And it's like, what do you need us to do? How do we make this better? How can we support you in this community? You know, and it started with, hey, our forms are not okay. Like, we need to change our language. Like, we need to make things gender neutral. And we did it. We are like 95% family equality trained, both in LGBT language, as you know, in addition with a specific transgender focus as well. And it speaks, you know, it speaks to the way our staff interacts with patients. You know, I think probably 20% of my patients are of the LGBT community right now, which I'm super excited and proud of. And the practice has just supported me in every piece of that puzzle, and no one is treated differently. You know, my patients are treated exactly like every other person that walks in the door. And sometimes I'd say maybe even a little better, because these journeys are fantastic. They're experiences, and coming into this from a place where, like, hey, listen, this is what I want to do, and I have to go through all these steps to get there, is, you know, everybody knows sort of the effort and the emotional and physical and financial stress that causes on people, but they so want to be parents that it's, you know, it's an amazing experience to go through with individuals and couples.
It absolutely is. So what's one of the first things if I were to talk to you about, you know, starting a surrogacy journey, what would be one of the first things you would want to discuss with me?
I talk a little bit about our practice. I talk about, you know, myself a little bit. I'm usually pretty honest with everything. I talk a little bit about our team, because it really takes a team to get you from the start to the finish here. And I think, you know, I can't do this alone. We have an amazing third-party team that kind of holds your hand through this process, because there's so much logistical stuff that goes in the back end that I can't sit and talk between the surrogacy agencies and the, you know, organized donors. So I talk a lot about how they'll feel like a part of this family. They'll have a very tight-knit team to work with. And then I kind of go through, you know, the steps of the evaluation of the individual or partner, some basic labs that need to get done, semen analysis. We talk a little bit, and I know that's well beyond this conversation, but we talk a little bit about fresh versus frozen eggs, and, you know, talk about timelines, how to get these things done. We talk a little bit about embryo development and how many children they want, and what they sort of decide that their family, you know, what they hope their family will look like. Because if an individual or a couple says, you know, I want one child, my recommendations or guidance for them is going to be very different than a couple who says, I want 2 or 3 children, right? So, you know, really have to sort of, you know, come in and explain and give options and start to open the mind to all these different difficult decisions that we're going to need to make along the way. We talk a little bit about the gestational carrier. You know, I encourage people to create embryos before they actually commit to an agency, but really have those agencies vetted in who they want to work with, so they can quickly move to finding a gestational carrier. We talk a lot about how they're my patient first, right? So the intended parent is my patient first, and is my job to protect them. So when I see a gestational carrier presented to me, both my team and I review that paperwork, and I tell people right away, there are some gestational carriers that I don't think would be good gestational carriers. There's some gestational carriers that have no red flags at all. And then there's some that have little things that it's my job to counsel those intended parents or parent and say, hey, listen, this woman looks wonderful. However, she had 2 C-sections. What does this mean? What are the potential risks? And then sort of talk together about the risks and benefits, and, you know, create like a little analysis in our mind. Is this the right person? Pros, cons, however they want to go through it. And we talk about that journey as well.
Wow, that's
a lot to talk about.
There is a lot. And I'll tell you, I want to thank you, Dr. Bloom. You've made already some really important pieces of content, video, that are part of the GWK Academy's Surrogacy and IVF curriculum on topics that we hadn't covered yet, or quite frankly, if we had, I just think you were you were able to articulate them in such a way that I personally was, oh, wow, I totally understand.
Awesome. Thank you.
That. So anyone that does sign up for GWK Academy will get to see you in several of your videos that you made for us. So thank you very much for that.
Perfect. Thank you so much for having me there.
Our pleasure. Is there anything else? I just want to see if we have a question. Is there anything else that you want to say to everybody before we sign off?
I just say, and what I tell everybody, you know, don't rush the journey. Everybody wants to bring home a baby today, yesterday. You got to be confident in all your decisions, you know your donors, feel comfortable with the donor, especially gestational carriers. That is some person that you have to trust like your partner, because they're going to be carrying your child. So don't just say, yeah, I think this is okay. You got to really look down and feel it in your gut that this is the right decision for you. And if it's not, if there's any red flags or anything that you say, you know what, I'm just not sure, it's not meant to be. And there'll be another gestational carrier that comes along. It's a very intimate experience. So you really need to have those open communication lines and be on the same page, and you have to trust that person. So I think it's a hard thing. I could not imagine choosing someone to carry my child. So it is a hard thing to go through, but just trust the process. Everybody's here to help you. We all of the clinics involved here have great physicians, and they have amazing teams behind them. And all the surrogacy agencies that we work with, is everybody has the same goals, right? So ask your questions, make sure you understand your answers, and, trust and feel confident in the people around you and your own decisions. Okay, great. I do have one more question that's come, and that's just COVID. Yeah. How is COVID still affecting surrogacy and IVF? If there's one day I didn't get a COVID question, it would be good. So I just answered a task that says question about COVID booster. I'm like, are we still here? It's really tough. A lot of intended parents want gestational carriers to be vaccinated. That's been a tough thing to accomplish, and the number of carriers have been lower for intended parents that are requiring or desiring a vaccinated gestational carrier. Again, hold your ground. If that's going to make you uncomfortable and this person's in a high-risk situation or work or something, and that's important to you, then you wait for the next one to come along. I think the fertility clinics have gotten really good at dealing with COVID, and there really hasn't been any breaks or glitches or anything in care for a long time. We do test our IVF patients at the beginning of their cycles, so gestational carriers going through would be tested at the beginning of their embryo transfer cycle, but we're not really seeing any delays in care or gaps in care because of COVID these days. Thankfully, we're back to full speed ahead here. Yes. Okay, awesome. Well, that's the COVID question for today. Okay, that's the second COVID question for today. I'd love to have you back here in a couple of months to answer some questions. Okay, awesome. Thanks, Dr. Bloom. Everyone, Dr. Bloom, Main Line Fertility. Thanks for watching. Thank you, everybody. Enjoy your night. Good luck. Take care. Bye now.